Welcome back to the Changing Earth podcast with author Sarah F. Hathaway and co-host Chen Gibson. Blending survival, fiction, and fact to bring you entertaining education that will help you dream, survive, and thrive. And now, here's your host, Sarah F. Hathaway and Chen Gibson.
Hello, and welcome back to the Changing Earth podcast. This is episode number 337. Hey, Chen, what's up?
Hey, chin's up, y'all.
Hey, happy to have you here. And we have an honored guest with us today. We have Dr. Joe Alton, better known as Dr. Bones in the survival community. Hello, sir. How are you doing today?
I am doing awesome. I'm so glad to be here with you, Sarah and Chin. And I'm really glad that we have gotten together tonight.
I'm always honored. Like I said, you always have an open invitation to my show because preparedness medicine is something that I would like to say, oh, yeah, I'm ready. But in reality, probably not as nearly as I should be. So always welcome to come on and talk about any kind of issues and, concerns that would be facing the community so we can help spread the word on that.
Hey,
Thanks.
Sarah,
I'm honored.
I got to say, I hear this voice and I'm a little nervous to drink the water.
Yeah, for those of you who don't know, Dr. Bones is actually playing Dr. Bones in the audio drama. And I was at a survival expo one time and a little birdie told me, Dr. Bones really always wanted to be a villain in a story. So, of course, you don't say that to a fictional author without getting results. And there you ended up. So how do you feel about that character there? How'd that one strike you?
Well, it sounds sort of interesting. Yeah, he's a guy who is a little amoral, I guess would be the nicest way to put it. And he has a plan of action. He's got an agenda, and he'll do anything to pretty much accomplish it. And so for me, I think it's interesting. People look at me and they see this goody, and it's fun that I'm being portrayed as something different this time.
I love
Mad
it.
scientist.
Yeah, and you guys, if you really want to get the full dose of Dr. Bones, you got to read my book, Swenson, because that is Swenson's backdrop, and Swenson and Dr. Bones have quite the relationship there. So, yeah. So get out there and read that book. I actually sent you over a copy of that, and I was pleasantly surprised to hear how much you love that book. That was really
cool. I read it beginning to end. It's awesome, an awesome book. Hardcore, man.
Yes, it can hit deep. It is a slap of reality. That book is.
Well, we need to sometimes. We're comatose for over the last couple of years, so we need something just like that.
It's true. That's true. So, Dr. Bones, I could sit here and ask you about all kinds of medical information, but today I'm really interested in getting to know the man behind the myth. So, how did you, as a doctor, come to find so much interest and passion in teaching people about preparedness type medicine?
Well, I had retired quite some time ago from a very busy medical and surgical practice in South Florida. I'm a fellow of the American College of Surgeons and the American College of OBGYN. And I had always been interested in disaster medicine since I volunteered to be part of a DMAT, a disaster medical assistance team, after Hurricane Andrew demolished pretty much my entire neighborhood in 1992.
Okay.
So I got interested, obviously, the hard way.
Yeah, just thrown into it.
Disaster. Mm-hmm. Right. And later on, of course, other disasters happened, like Hurricane Katrina. Epidemics happened, like the swine flu pandemic of 2009. And I realized around that time that a lot of the deaths that occurred might have been prevented with a healthy dose of medical preparedness. But no physicians were writing about it from a survival standpoint because they, in general, they couldn't imagine a situation where modern medical facilities weren't just over the horizon. They couldn't imagine a scenario where the ambulance was heading possibly in the other direction. or the casualties were more than the available medical resources can handle. But that kind of stuff happens all the time. And we found that the hard way also in this country with the COVID pandemic. I mean, there are events in which people lose their lives simply because they had an emergency during, let's say, a flood or a blizzard, and medical support couldn't get to them. There are lots of situations where that happens. Hurricane Katrina is another example. There were hundreds of DMATs that descended upon the area even before the storm was completely over, and they were unable to get to people that needed their help, they're dying, simply because they just couldn't get through the roads. The roads were all flooded. So there's that. There's outbreaks of infectious disease. There's a current pandemic, of course, where some areas were taxed beyond their limit in terms of these ventilators and other critical medical technology, the modern technology. And look what happened to this nation, to the world. The fabric of society with a disease that killed maybe 1% of people that got sick from it. Mm-hmm. And what if the death rate was 5%? What if it was 10%?
Yeah.
What if it was Ebola, where it's like 40%? I mean, the whole fabric of society would be torn asunder. And so I wrote, I wrote about what could be done to prevent and treat injuries and illness without modern medicine. I mean, between Amy and I, we figured out strategies that might be able to prevent some of the avoidable deaths. And with some knowledge and supplies, maybe we could save some lives. And, if we could put a medic in every family, we felt that would make a big difference. So that's the mission. That's our passion. To put together an army of medics held in reserve, quiet, unassuming, left for times of trouble.
And you put this together in an awesome book. Tell everybody what the name of the book is so they can go get it, because it's like you have to have it in your house for these emergency situations. It's just essential.
Well, our main book is the Survival Medicine Handbook, the essential guide for when help is not on the way. And it's now in its 4th edition. It started off as a 300-page book, 6x9, and now it's like an 8x10, 700-page book. And it covers probably 200 or 300 different medical topics, and it covers it from beginning to end as if a disaster occurred and there is no longer any modern medical technology, that it's you as the end of the line, the average citizen as the end of the line when it comes to the safety and health of your family, because some disaster occurred that took away hospitals, doctors, that kind of stuff doesn't exist. So nowhere between the first page of the book and the last page of the book does it ever tell you go to the hospital or go to the doctor, because it assumes they no longer exist.
Yeah. I love that aspect too, because Chin, remember when we were talking with, was it Kevin? And we were talking about different short-term emergencies that would happen. And he was like, well, this is how you wrap it up or whatever until you can get to a hospital.
Yeah.
Until you can get him to help.
You were trying to get him off that box, and he kept standing on it.
Right. And I'm like, what if you can't get to a hospital? What do you do then? Are they just going to bleed out or whatever? And so that's been really, really interesting. And then also writing so much survival fiction, of course. I'm always picking your brain because what do my characters do? We don't experience this world.
Right. They've got to figure out some alternatives, in times of trouble. I mean, if the hospitals aren't working, if the doctors aren't there, I mean, somebody's got to take over, and they've got to use found items or other kinds of basic improvisations just to get by.
Yeah.
And it can't be done.
So I'm going to squirrel just for a second, because I'm so curious about, so they used to do all kinds of just cut the limb off kind of thing to save the person. And what if you have a deep laceration where you have an artery, or would it be a vein or an artery that's just rapidly splurting blood? You can't get to a medical facility. How do you stop that from happening without tourniqueting forever? Because tourniquets are good till you can get to help. How do you stop that kind of thing? This is just a personal question.
Well, to begin with, of course, direct pressure is the first thing you're going to want to do on it. And so direct pressure will stop bleeding. That's not completely arterial. So if you have an arterial bleed that spurts out, there's a difference between venous and arterial bleeding, right?
Mm-hmm.
The venous bleeding sort of comes out steadily, you know, in a steady flow, but arterial bleeding comes out in spurts. It sort of squirts
Mm-hmm.
out in conjunction with what the pulse of the person would be. And so basically what you want to do is you want to get to that bleeding area. And so you take anything that you have on you, that could be a fabric, could be a shirt, could be, you know, just about anything, you know, paper towel, anything, and just stick it right on the area that's bleeding. So you can try to find and try to wipe it so that you can see where the bleeding's actually coming from. If it's bleeding in an extremity, for example, it's always the bleeding is always going to come, or it's always going to originate from the upper part of the wound, the part of the wound that's closest to the torso.
Right.
Okay. And so if you had, let's say, I'm looking at what I have right here. If you had a clamp, for example, of course I have all sorts of stuff here, but if you had any kind of clamp or any kind of tweezer or something that could grab it, you know,
Mm-hmm.
then, or even a needle nose plier, you might be able to actually clamp that artery. Arteries have muscle to them, so they actually do have some tone, I guess is the best way to put it. I mean, it's hard to just tear them in two. Our veins are not quite as sturdy.
Gotcha.
But,
okay.
But what you can do is you can just grab it with a clamp or grab it with anything that you can just clamp it between two things to apply pressure from both sides. You might be able to stop the bleeding. And in that circumstance, once you've done that, if you had a bandana, let's say, or if you had a strip of cloth. I mean, some people say a belt, although I think that's sometimes pretty hard to do. Just wrap that around 2 inches above the level of the bleeding, tie it, and then use let's see, you could use a stick, I have a Sharpie here, and then you place the Sharpie on top of the knot that you made, put another knot on top of that, so you've got the Sharpie in between the two knots, and start twisting. You start twisting and twisting and twisting until you get enough pressure, and then you tie another knot to secure it in place. And so there you have it. I mean, so no tourniquet.
You stop the bleeding at that point. Yeah.
You could stop the bleeding. So
Okay.
for at least for the time being.
And then would that be something that, like, in the long run, you're cauterizing it, or like what?
Well, that's the thing. What you're wanting to do is you want to get that person. Ordinarily, what would the average medical doctor or other medical professional will say? You got to get that person to the hospital. But
Right,
obviously,
of course.
you're the hospital, so you basically want to get that person to where the bulk of your medical supplies are. If you're the medic, and if you're the medic, you're going to have a hospital tent if you guys are if you're on the road, or if you're in place or if you're bugging in. Basically, your home is going to be your field hospital.
Mm-hmm.
So you want to get that person to a controlled area, a controlled situation where there's not bullets flying everywhere, where there's not a middle of a rainstorm. So you have them in a sheltered area where you have bulk of your medical supplies. And then you can start working to start stitching that area up. And there are a lot of different ways to do that. I mean, if you have fishing line, let's say monofilament line, you can do that in a sewing needle, and you can stitch that up. I always recommend that people buy some curved needles. There are curved sewing needles, and some of those are very useful, I think, as an medical improvisation for survival settings.
Yeah, my mom always she did upholstery, so she always had those curved needles. She's like, oh,
Right,
patch
exactly.
you up.
And those are great.
What's your thought on using the interior of paracord as stitching?
Yes, absolutely. Interior paracord is stitching, fishing line. I mean, you could use that stuff is, it's got a million uses.
Mm-hmm.
But yeah, I think that would be a perfectly fine use for that.
Okay, excellent. All right, so back to getting to know Dr. Bones a little better. So I have a very important question for you as a fiction author. What were, give me like two or three of your favorite fiction survival books, or maybe not even survival books, but 2 or 3 fiction books that you learned the most from?
Well, I have to say that that there's books I learned the most from, and there are books that I find the most entertaining. And yours, I think I put you in the entertaining section because you have real page turners as part of your works, or your work is basically very entertaining, very exciting stuff, and real page turners. There are books that are like other books, like let's say by James Wesley Rawls, Expatriates is one of them that I can think of right offhand. That is like a technical manual, and that it's not exciting really to read these books, and it's sometimes tedious to get through. But you learn so much stuff in there. You know exactly which Allen wrench to use to do this, and you need to know what nuts and bolts to do this, to do that. I mean, it's amazing, really, the amount of stuff he puts together. Other books that I enjoy and that I've learned from, I would say 1 Second After by William Fortune is a good book.
Yeah.
I'm a little biased towards some more than others because I have had the honor of being mentioned or had characters based on someone like me in a few. I mean, that's one of the reasons. I mean, even if actually, although that's a reason why I like your book, it's not the whole reason because it's such an entertaining book, but an entertaining series. But I also like The Unraveling by Charlie Hogwood, Legion of Despair by Franklin Horton, As the Ash Fell, A.J. Powers, Glenn Tate's books, Terry Blackmore, Jeff Moats. There are a lot of people that I like, and I learn from every single one of these books. And I actually learned from your book too. I learned how bad it can get.
yeah. That one is definitely the how bad can it get? Yeah. Yeah.
So, so I've had the honor. Actually, I had the honor of being mentioned in a couple of the books. In one of these books, they happened to find an old survival medicine handbook in the ruin of an explosion. Other ones, some guy actually was able to sew somebody's wound up, and they asked, "How'd you do that?" Well, Dr. Bones taught me.
Nice.
Yeah. So I'm very honored by that kind of stuff, and it turns out that these guys are actually pretty good writers too.
Yeah, you've made such a positive impact on the community. One book that it's not a fiction book, but The Absolute Anarchy is like one of my Bibles as far as how to ethically handle crisis and really how.
Yes, that's Johnny Jacks.
Yeah, Johnny Jacks. Yeah.
Yeah, and I think he was nice enough to either mention me or recommend my book.
I think you wrote like the foreword in this one. The one that
I write. Oh yeah, I did write the foreword. I've written the foreword. I've been honored to write the foreword actually on a number of books, and and that I think when somebody asks you to do that is actually one of the great honors of my life. Because that book is forever. You know what I'm saying? And for a person to ask you to write the foreword to a book like that,
there's not many words.
A little
for that.
sentimental.
That's a great honor. That is a great honor. So I wanted to go a little bit back to basics. Might be too basic for the Prepper Broadcasting Network, but everybody's got to start somewhere, and we all need our roots to grow from, right? So
sure.
Tomorrow, CME hits, earthquakes hit. Tomorrow, our society has just dive bombed, and like you say, has just ripped the fabric of our society apart. What are some of the most immediate things that we need to be thinking about and be concerned about when it comes to our future medical health?
Okay, the bottom line with regards to what you need immediately is, you need water, you need food, you need shelter.
Right.
These are the most basic, important issue. And the thing is that you look at those issues and you say, well, that's not medical stuff. But truthfully, things like a water filter, things like a fire starter that you could make a fire and cook food with, a roof over your head, all these things aren't considered medical items, but they're indeed necessary if you want to stay healthy off the grid. I mean, if you don't have a way to make a fire in a blizzard, you're in trouble. If you are in a place where the water is questionable and you don't have a water filter, I mean, you're going to be in trouble. So these things are indeed medical items that are necessary if you want to stay healthy off the grid. Because let's face it, if you have questionable water, you have poorly cooked food. I mean, that's what happened with Ebola. That's how the Ebola epidemic in 2014 occurred. That somebody was cooking bats, and they didn't cook them all the way through over these 55-gallon drums that they had fires over. And so they ate the bats, and the bats are what had the Ebola virus. And 10,000 deaths later,
oops,
that was all because they were eating bush meat that was, half cooked.
Yeah.
So all this stuff leads to diarrheal disease, leads to dehydration. Once you get dehydrated, well, that can kill you. I mean, it killed more soldiers during the Civil War than bullets or shrapnel, right? Mm-hmm. And in a long-term disaster, you got to expect to be thrown back to that era from a medical standpoint.
And the water is an important thing that, I don't think the average person who's not in the survival, that doesn't think about that. I fear for them because, water, drink it. And like you say, the what you can pick up from the water, and then the dehydration or the nasty poops, that
right.
just dehydrate you and whatnot. That can be serious stuff. And so that really concerns me about the average everyday Joe that's out there. Oh, no pun intended. But
and that's what I'm saying. And that's what I'm saying. The avoidable deaths in the first few weeks are going to be oftentimes caused by simply drinking the wrong water, simply not cooking food because you didn't know how to make a fire that would cook your food thoroughly. These are the things that are going to wind up killing people in the first few weeks. Now, besides safe food and water and protection from the element, of course, you want to have supplies like medical supplies to deal with the most common medical issues that you would encounter off the grid. But what are those issues, right?
Right.
So I've got a list here. I actually have it written down here. A list that was put together by a Doctor Without Borders. He was the sole medical provider in a remote region for, I think, about 15 months out of a total of 3 years service. And there was nobody else but him. It was him and whatever he had in his backpack.
Oh,
and
wow.
Pretty much, and occasionally would drop something to him.
Uh-huh.
Well, the things that he faced were, I'm reading here, so forgive me, minor musculoskeletal injuries, so that would include sprains and strains, things like that. Mm-hmm. Respiratory infections. So see that? So it's not all trauma. He had colds and flus, and ordinarily you wouldn't think of respiratory infections as one of the most common medical issues you would face in the bush, but sure enough, now that COVID's been around, respiratory infections, almost everybody has had one in the last couple of years.
Yeah, and if the average person thinks about, how much decongestant type medication do you buy from the store every, month? It depends. Do your family have allergies too? Because then, you're buying more. So dealing with those things without being able to go to the store and buy something, here, take this decongestion, you're going to feel better. That's serious, and it can majorly disrupt your work performance. Those types of things can form into pneumonia, right, and pleurisy and things like that.
And so a lot of these things, if you don't treat them, if you don't treat the symptoms, you wind up getting more congested. For example, if we're going to take that specific example, more congested because you didn't have nasal decongestants, and the phlegm gets thicker and thicker. It winds up getting stuck in the airways, in the bronchioles and things like that. And soon enough, you get pneumonia. Mm-hmm. And so, sure, interestingly enough, allergic reactions, which you just mentioned, is also on his list. Minor trauma, cuts and bruises and scrapes, minor infections. Now, interestingly enough, ear infections, eye infections, and bladder infections. These were the things he saw most.
Yep.
Diarrheal disease. There you go. So that's in the list. Dental issues. Now, that's the thing that nobody really thinks about, is that if you are in a situation where there's a storm and you're a week, a hurricane passes through, you're a week or two without power, well, you probably don't need a dental kit. But I'll tell you, if you were in a true long-term survival setting, 6 months or more, that kind of equipment, dental equipment, would be probably some of the most important stuff that you could possibly have, because dental issues start cropping up, and once they do, they affect work efficiency like nobody's business. If anybody's ever had a toothache out there, you know that you can be doing anything. You can be at work, but or doing something, or you mean with kids and things like that. But the only thing you can think about is that toothache. You want to just tear that tooth. You want to rip that tooth out of your mouth.
Yes.
And
yes.
So it's right. And so dental issues, you got to have dental supplies. And this is one of the things that this doctor teaches us by the fact that he was there. And I researched it in Vietnam, during the Vietnam War, at the sick call, daily sick call. The medics noted that about 50% of their sick call patients were for dental problems, not medical.
Yeah,
so
I had one dentist on the show who was willing to come on the show and really talk about dental issues and things that we'll be facing, and he was like, with a cavity, if you even just use like the cavity fill stuff, okay, but there can be underlying, and that can just get worse and worse and worse. I mean, we're just to the point then where if you don't have an x-ray to see what's going on, to be able to get that really cleaned out, even as a dentist, you can't really do that job that, to peak performance without those types of tools. So it leaves them all just kind of guessing.
And that's why 90% of dental emergencies that are going to occur in survival situations are going to be treated by extraction.
Mm-hmm.
Your dentist, what is his goal? His goal today is to save every tooth that he possibly can. So we go through all these acrobatics to try to save the teeth, and I think it's wonderful that we're able to do it so often. But in a true survival situation, 90% of dental emergencies are going to be dealt with by extracting. And that's why we put together dental kits, and the dental kits that we have several different extractors for different types of teeth.
Oh, we can't just pull out like the Coleman or, use the big pliers or something.
Well, you could tie a little string or some dental floss around a tooth and then to the doorknob. And
the doorknob.
Yeah. Nope. Actually, this is the best way to do it, because the thing is that what happens is you wind up, unless it's a baby tooth, you wind up pulling out the tooth and not the root.
Yep.
And that gets you in big trouble. And that's why our survival medicine handbook actually has a huge section on dental issues. And that tells you how to extract a tooth, tells you how to deal with a dental abscess, things like that. Things that ordinarily wouldn't be dealt with the same way in normal times, and certainly would be dealt with differently than what I'm sure your dental guest discussed with you during his visit.
And you definitely wouldn't find it in the same book that's going to teach you how to, repair that femoral bleed. That's going to tell you how to, deal with the respiratory. Yeah. Right.
And exactly. That's the thing. And that's why we included pretty much everything that we thought you could see that we could fit in 700 pages.
Right.
And so that includes things, going back to the list, I mean, he saw people who dealt with hyperthermia, things like heat stroke and stuff like that. But I'm going to add here hypothermia, exposure to cold. This guy happened to be in a tropical environment, but things can be just as bad the other way, depending on how far north you are or what the weather conditions are. He saw major traumatic injury, saw skin rashes and burns. And here's an interesting one. One of the big issues that he dealt with on a regular basis were birth control issues.
I was going to ask you about that.
Pregnant, women's issues. That was a big part of it. And one thing that one bit of advice that nobody has ever given, but I put in the book, is that if you want to be fruitful in the early stages of a survival scenario, don't multiply.
Yeah.
So if you want to be fruitful, don't multiply. You basically, anybody who has been pregnant knows that you are not always at 110% efficiency. I mean, you've got back pain, you may be nauseous, all sorts of things happen.
I mean, your hormones alone are just make you into a psycho.
Right.
Yeah.
There's all sorts of stuff. And so and also there are complications that can occur. I mean, 10% of all pregnancies end in miscarriages. That means bleeding and things like that, sometimes infection. And of course, even if a pregnancy goes right, it may not go right afterwards. You can get a postpartum fever. You can wind up getting, in the year 1800 in the United States, the average woman could expect to have 8 to 10 pregnancies.
Yeah, I was going to say, and the amount of women that died in childbirth and around that time, it was astronomical.
Right. The death percent was 2% per pregnancy.
Yeah.
So 8 pregnancies, 10 pregnancies, you have a significant number of women that died as a result. I mean, I spent half of the year in Gatlinburg, Tennessee, and they have a lot of these old family graveyards there. And if you go there, you just take a look and you see all these 20 and 30-year-old women who died, at those ages. Mm-hmm. And I guarantee you that they didn't die because they got run over they got eaten by a bear. I mean, they died because
got the vapors.
Yeah. They died in childbirth. Right. So those are the things that he had in his list, and those are the things that you have to be prepared for. So what we learned from his experience, you can be pretty sure you're going to need things like antiseptics, bandages, dressings, burn gel, wound closure materials, blankets and sheets, antibiotics, pain meds, blood clotting agents, splints. I mean, so much stuff. I mean, dental extractors, so much more if you're going to be an effective survival medic. So that's why it's important to begin the process of becoming medically prepared now before a disaster has occurred, because there's a lot to learn, and there's a lot of materials to put together, and lots of things that you can do to improvise. And a lot of this stuff can just be found items too.
Yeah, touch a little bit on your bandage situation, because you have one of the coolest analogies that I've ever heard, and it's the absolute truth about how much blood, like if you were to, the soda can analogy is what I'm thinking of,
Oh, right, yeah. If you took, I had a patient I've had many patients. In this case, I had a patient who had a pregnancy in her tube. Okay, and the pregnancy in her tube was the size of a dime, but the tube is much smaller than the size of a dime. And so what happened was the pregnancy went along for a few weeks and developing in the tube instead of the uterine wall.
Right.
And it ruptured. Eventually outgrew the tube and ruptured right through the wall of the tube. This tiny, tiny little pregnancy, and there was just a tiny little hole where it made the hole in the tube. And she bled out 2 full liters of blood in her belly. Now, if you took a 2-liter bottle of soda and you poured that on the floor and then took all the bandages that you have accumulated in your medical storage, you probably would come to the end of your bandages before you come to the end of the soda. Mm-hmm. So that's the thing, is that you can never have enough medical supplies. You never can have enough. That's something that I think I try to drill that into people. I mean, and even if you look at it this way, you could even consider this extra stuff as barter items. I mean, Rawls always says that, ammunition is the barter item. But I think medical supplies can be the barter item too. I mean, if you have enough that you could actually part with something.
Right.
But having said that, I have to say that I always tell people, instead of necessarily doing that, I always say, offer your services, offer your supplies, as part of your services, to the community at large. And you, as medic, will become so important to that community that they will expend their resources to protect you.
Yeah. Yeah, because you can help them with that tooth when it comes up. You can,
exactly.
Yeah.
And much more. Deliver that baby.
Mm-hmm. Yeah, no doubt. That was like the most. I always think back to like the Little House on the Prairie type scenario, and the doctor there was like pivotal. He was a part of everybody's life.
Exactly. There you go. And so you need to be that person.
Yeah. None of these
or
fast
somebody
food
needs
doctors.
to be that person. Somebody has to be designated in every family as that person. And so that's what we're trying to do, is we're trying to find those people and get them prepared so they'll be effective in their role.
Yeah, and your Pantheon, I mean, at your website is just like endless. You can find anything like you would possibly could ever have a question on in your website. You guys have built that thing so beautifully beyond the book. Then you have all that information. I mean, it's just spectacular, the work that you've done. Your passion is obvious.
Well, I appreciate it. I appreciate it, Sarah. It's just like your passion for writing.
Yeah.
And it's something that has just become part of my nature at this point. And I don't know how long I have left on this earth, but I will be probably writing about medical things and trying to think of solutions for times of trouble that hopefully will never come.
Right. Yeah, that's what I always say. But at least then we leave it for our children. We leave the materials for our children to learn from.
Exactly. That will be my legacy.
So, big disease wise, what, like, I've heard of cholera. I've heard of things like this that could be, or, even Ebola, if something like that were to happen. But what's like a common, very, a common disease that we don't really deal with maybe on a big basis in our country now that we could have on the horizon in that type of scenario that we should be aware of?
Oh, we could have yellow fever. We can have malaria. Probably mosquito-borne diseases will become much more rampant if we wind up being an off-grid society again. If you go to New Orleans or you go to Savannah, there are whole graveyards that are dedicated to people who died of yellow fever or died of cholera or, those kinds of types of epidemic diseases.
What is cholera? Break that one down for me a little.
Cholera is a bacterial disease caused by Vibrio cholerae. And it basically is something that drives your fluid evacuation system into overload. And so it's a diarrheal disease that you can wind up losing 50% of the water in your body within the first day.
Wow.
And within a few days, you're dead.
And you get that, like, it passes through water, or it passes through, how does it pass?
Passes through you, through one, regardless of how much is going in one end, it's just going straight out the other.
Okay. And, but like, how would I give it? Can I give it to somebody in my family? Is it communicated that way?
Touching them. It's usually caused by eating contaminated food.
Okay.
Or water, drinking contaminated water too.
Yep. So it'd be in the food and the water. So the filters, again,
right.
We're down to filters and
right, exactly. And the person there are people that are carriers for this. There was a cook in around the year 1900 whose name was Mary something. Okay, well, she became known as Typhoid Mary because everywhere she went and every place that she worked for, every family she worked for wound up having people dying of cholera. And it turned out she's a carrier of it, and she was cooking all the food and she was, making all the drinks, for the family. That was her job. And she was just infecting everybody.
Wow. Yeah, I knew about Typhoid Mary. I didn't know it was actually because of like cholera outbreak. So that's super enlightening. Okay. And so as a medical professional, what is your like standard? What water filter are you going to have in your go bag?
Well, I have, first off, I try to, basically there's just not a lot of space in a backpack. So I think mini Sawyers are good. Life straws are good. I think these are the things that I think everybody should probably have available. Especially if they're going to be on the road, for example.
Yeah. And then what if you're bugging in? What do you got? What do you have? What's your go-to there?
Berkey. I have a Berkey water filter, one of the bigger ones. and I think I actually got that in a contest, when I won a contest through Survival Blog. They had a writing contest, and
Okay.
I wound up getting a Berkey filter, and it's an excellent, solid filter. It'll last for years.
Look at you entering the competitions. I love it.
Nice prize.
That was a long time ago.
Yeah. So what's your opinion, distilling water over the filter or the filter over distillation? Because I've heard that distillation is just like the best way to go, because sometimes it can even handle chemical contamination, although, I mean, you shouldn't rely upon it, obviously, but if you have to, you have to. So what's your kind of opinion there?
Well, I think basically just filter it. I think distilling it, I mean, you need equipment for that.
Mm-hmm.
So basically, I think, just a filter, just start with that. You're basically trying to get to the point that you can easily provide enough safe water for people to drink to get to the next stage.
Yeah, and then cook with the clean water. Don't use the contaminated water, right? Yeah.
Exactly. Right.
Boiling. So you don't have a water filter. What's your opinion on boil? Everybody says like boil 3 times.
The CDC actually tells you what to do. I mean, basically it says 1 minute of boiling, 1 minute of a rolling boil or a roiling boil. Basically, you got to get a good, just get it boiling, have it sort of just turbulent boiling water, get for 1 minute, and that is fine as long as you are at sea level. If once you're at 3,000 meters or higher, then it's got to be 3 full minutes of boiling.
Okay.
So
All
it's
right.
between 1 minute and 3 minutes. That's now the official. It used to be that per 1,000 feet they would change what the amount of time was that you would boil. Now it's just sea level, 1 minute of boiling. Period. That's all you need to do. 3,000 meters or above is 3 full minutes of boiling.
Okay. And then what's your opinion on like being able to set up a quarantine facility in your house, that like everybody should have the equipment to do that, basically, if you can?
Well, yeah, absolutely. Well, yeah, everybody should have a sick room prepared, and in indeed the Survival Medicine Handbook, one major section is how to put together a survival sick room. And so the survival sick room has to be minimalist in nature. That can't be using fabrics, any kind of fabric furniture, things like that. You want to basically have the simplest work surface. You want a work surface. You want an exam surface. You want a cot for people, and you want to have plastic sheeting in places that, for example, if you have somebody who's sick and needs to, and maybe vomiting or things like that, you basically need some plastic sheeting. So that would be a very basic sick room setup. You want to have some lighting. You want to have ventilation. These are some of the things that are important. There has to be a distance away from the common areas of a house or a retreat. So, you definitely don't want to have a situation where you're going to have people, other family members walking through where people are actually physically sick or infected. Okay. And remember that your sick room is not for injured people. You want to have a different area for injured people than you have for infected people.
Okay. That makes sense, because you don't want them all in the same space. Then you're just going to have injured people getting sick,
Exactly.
People being afraid to go in the hospital right now. So, Chin, I don't want to soak up all the time. We got a few minutes left. Now, have you ever had any burning questions that you've wanted to ask Dr. Bones? Because now's your chance.
No, actually, I have a little story. So I met Dr. Bones, like I told him in the green room in Asheville. He was kind enough to give me a signed copy of his book, and then I couldn't find a book. Come to find out, my wife took the book and has it in her little portable first aid kit.
Oh, no!
I finally found the book. Yeah, my wife liked it so much. She's got it tucked away with the our traveling first aid kit. So, yep.
She gets all your good stuff.
I know, right?
Yeah.
Yep. So
you're gonna.
It's a great book. I mean, you can like reference almost anything out of it.
Yeah, it's a staple. It's a staple.
It's nice for you to say. I really appreciate it.
Absolutely, yeah.
Yeah. Well, I definitely admire all your hard work. You've done amazing things for this community, because it is like, yeah, we can talk to emergency medics and things like that all day. But when the bottom line comes down, they're like, yeah, until you can get medical assistance. Well, who's doing that, right? At that point.
Right, exactly.
And what are we supposed to do? So it's just such a wealth of knowledge to be able to draw upon. All right, so we're going to get into some Changing Earth news and let you go, Dr. Bones, but go ahead and let everybody know what your website is and where we can find you, where we can pick up your book. Where do you make the most money off a book sale? Because that's where I will buy the hard copy for my house, because I only have a soft copy right now, and that's not going to cut it.
Well, our website is doomandbloom.net or .com. Either way, we'll get you to our 1,200 or more than 1,200 articles, podcasts, and videos. You'll find our books at Amazon.com or at store.doomandbloom.net. We have an entire line of medical kits also at store.doomandbloom.net. We have just so much stuff. We have the Survival Medicine podcast on Blog Talk Radio. We have the Dr. Bones Nurse Amy channel on YouTube. All sorts of places that you can connect with us. And if you ever want to get a hold of us personally, just contact us at drbones podcast, Dr. Bones podcast, drbones podcast at AOL.com. Or I should say OLD.com.
Yeah, I was going to say, wow, you're still sporting the AOL. All right.
The last person who has an AOL.
That and Hotmail, yeah.
Yeah, how about that?
So if I'm cruising over to your website and honestly, I'll tell you honestly, a little inside baseball, my medical supplies need to be restocked so badly right now. So if I'm cruising over to your website and I'm starting from scratch, we'll just call it scratch, what do you suggest is the best kit to start with? Well,
I think the compact kit is good. It weighs about 1 pound, 11 ounces. It's MOLLE compatible. It's basically packed in a solid Voodoo Tactical EMT style bag, and it was recently named one of the top 10 kits rated by survival experts in New York Magazine.
Wow!
So it's a solid kit and not too expensive, but it has the ability to deal with an awful lot of issues. So
that one's obviously Go Bag compatible.
Yeah, absolutely. And also, I just want to say that if you are looking for individual supplies, we do that too. We sell you cases of bandages if you want, or dressings if you want. All sorts of individual stuff that you'll find there too. If you're just missing a few things from your medical supplies that you need to fill some holes.
That's where I'm at. Yeah, I've been using it along the way, and now I'm like, oh man, I got to restock again. Okay, what about for like a family of 4? If you weren't planning on bugging out, you're planning on staying in, you got like the awesome kit that would help that family of 4 make it into a longer future?
I have two kits that are big for that, meant for entire families, and it depends a little bit on what you think is going to happen and what your situation is. For example, let's say if you live let's say you live in the middle of the city and there's a lot of civil unrest, society's gone to hell, you can expect to have lots and lots of traumatic wounds among your people. Well, then I would go with what we call our Stomp Supreme Bag. That Stomp Supreme Bag has multiple tourniquets, multiple Israeli dressings, the ability to deal with all sorts of stuff, but it also has our basic stuff, which deals with diarrhea, deals with medical problems. So you have all sorts of medical issues that you can deal with, but also you have the surgical trauma issues. It comes with a suture kit, staple kit, lots of sutures and lots of materials there, more stuff, burn gel, more stuff that you can shake a stick at. SAM splints, we have 36-inch SAM splints, the malleable versions that you can use for just about anything, and it comes with a copy of our book too.
Perfect.
So it tells you exactly how to use all this stuff.
Yep.
Now, let's say you live on the top of a mountain and the zombie horde is not going to be approaching you. However, what you expect to happen is going to be a long-term event, and it ain't never coming back. Well, then you can consider our ultimate family bag, which is also has the materials for all those people, for an extended family. It doesn't have quite as much trauma stuff, but it comes with a dental kit.
Okay.
And it also assumes that you're eventually going to expend even all the stuff we give you, which is massive quantities of stuff. You're going to expend that, and also comes with things like salves and essential oils, and it comes with a lot of natural teas, a lot of natural stuff that will replace the herbal tinctures it comes with, that will replace the commercial stuff that's going to run out eventually.
Perfect.
So
All
there
right.
are a couple there. I think we have a comparison, side-by-side comparison of them on the website, so you can take a look and see what makes the most sense for you. If you had to actually take the hundreds of items that are in these kits and price them out yourself and actually put them together yourself, it probably would take you an entire year to do it.
That's what I'm saying. Yeah.
But we have them ready for you, and we pack each one individually custom, so there's things are always fresh, and we give you a number of different options so that you can, if you were, let's say you're ex-military and you were used to using a certain type of tourniquet there, we got it most likely.
That's
so
cool.
you can pick an option, or bags are waterproof. We also have some of our kits can be put in hard cases in case you are going to be on the water in a boat. So lots of different choices. We have eye kits, nasal trauma kits. We have obstetric kits that are absolutely the most advanced kit that you'll find outside of your local labor and delivery room. And we have I think, one of a kind, absolutely the best dental kit that you can find on the market. So these are things that I think you might consider looking at. You just have to decide if you are ready to make the commitment. Are you ready to pick up the flag and become the medic and the end of the line when it comes to the family, the safety of your family and the health of your family if a disaster comes.
Or maybe I'll just buy it for my son. Make him be the medic.
Okay. All right, there you go.
Yeah.
Hey,
yeah.
a side note, I'm looking through your site, and I actually see that HSA and FSA eligible kits in here.
Oh yeah,
so
absolutely.
If people want to use their accounts to actually stock up.
Mm-hmm.
We do a lot of that. We do all the paperwork for you and get you the receipts and all the things that you need.
Nice.
That's really cool.
A little extra.
That's real cool. Okay, one more time, where to find you, and then we'll let you go enjoy the Super Bowl.
All right, sounds good. Doomandbloom.net. Just go there, and you will find all the information that you'll need to get through the next big disaster.
Thank you so much for your time. Like I say, open invitation. Let's maybe bake we could do a monthly medic interview or something like that, because I just have like a myriad of questions that I just thought about, and I'm like, we're out of time, Sarah. So
well, it's been an honor to be on with both of you, and I thank both of you for what you do for the community.
Thank you. Have a good evening.
Yeah, thank you, Doctor.
All right, so that was Dr. Bones. Always a pleasure.
And I posted links to his sites and his books in